While the format of this event is different this year, we're glad to be sharing this time together live on Zoom. Welcome to all friends, family, and loved ones who are joining us from outside the OT program, and we thank you for supporting our students along the way. Also, a huge shout out to all of our faculty and staff for all the gifts you've shared with our students, with their research projects and throughout their time at Ithaca College. Grad students, we are so excited to learn more about your projects. Before we get started, we want to make you aware of a couple of the accessibility features for the presentations today. We will be using Zoom's live transcript feature for all attendees, which will create automated captions throughout the event. To turn off the closed caption, click on the CC Live Transcript button that is located at the bottom of the Zoom screen, and then click on the Hide Subtitle. Everyone will be muted automatically upon entry to the meeting to reduce background noise. If you choose to mute your video, the name on your account will be displayed. During the question and answer period, we will be fielding questions from the audience through video, audio, and the chat, so feel free to engage in the technology in whichever way feels good to you. I will be moderating the questions through the video and audio, and will invite you to unmute yourself to ask a question. And Jenna, Joe, or Shannon, depending on which session we are in, will keep an eye on the chat box for questions there. So please, when you're typing your questions in the chat box, please direct the message to the co-host at the time. For those of you who have unmuted yourselves to ask a question, please mute yourself again afterwards to reduce distractions and background noise. And one last thing before we get started, these presentations are being recorded, and along with the full transcript will be posted on the virtual OT site for our current students, faculty, and staff to access. Now it's my pleasure to introduce our first presentation of the day. Maggie.
Good morning, everyone. So on behalf of our research group, I would like to thank you for joining us for our research presentation entitled Ethical Issues in Gender Expansive Health Research, Amplifying Voices from Transgender and Gender Non-conforming Communities. So my name is Maggie Callery, and my fellow student researchers are Zoe Barker, Shannon Dolan, Rebecca Hall, Alexis Kleet, Leah Maginnis, DK McAllister, Jake Mozer, and Emily Shiffman, and this research was conducted under the supervision of Dr. Ungco. So in this presentation, we're going to be going through the background and some terminology related to our topic, a review of the literature relevant to our topic, the methodology and how we kind of designed our research study, some of our results, and discussing the implications of these. Okay, so starting with the background. So first, to go over some terms, we'd like to add a disclaimer that this list of identities is non-exhaustive and not everyone you meet will use these terms or identities in the same way. So gender expansive describes a person with a wider, more flexible range of gender identity and/or expression than typically associated with the binary gender system. Gender identity is a person's internal personal sense of being a man or woman, or for some people, their gender identity does not fit neatly into these two choices. Sex is a label you're assigned by a doctor at birth based on the genitals you're born with and chromosomes you have. Transgender is a term that can be used to describe people whose gender identity does not match the sex they were assigned at birth, while cisgender is a term that describes somebody whose gender identity matches the sex they were assigned at birth. So gender nonconforming is a term that may be used by people who do not conform to gender-based expectations and stereotypes. It can be an identity label or an umbrella term, and can include trans, non-binary, genderqueer, and cisgender people. As a heads up, during this presentation, we'll be using the acronym Tgnc to describe transgender and gender nonconforming communities. And some related identity terms you may see come up in this presentation are non-binary and genderqueer, which describe identities that do not fall exclusively in the binary of man or woman. And finally, gender dysphoria is the distress that may accompany the incongruence between one's experienced or expressed gender and one's assigned gender. Not all trans, non-binary, or gender non-conforming people experience dysphoria. So currently, there's a lack of high-quality healthcare research that includes gender-expansive participants, which contributes to suboptimal health outcomes for these communities. So the purpose of our study is to understand the lived experiences of gender expansive people who have participated in a research study. As a result of this study, we aim to improve future experiences of gender expansive people by understanding the supports and barriers presented when engaging in participants in the healthcare research process, particularly related to the power imbalances between cis researchers and gender expansive participants. All right, so our two main research questions are: what are the experiences of gender expansive participants in research, and what motivates gender expansive people to be involved as participants in research?
There are various social and systemic barriers to access effective healthcare services for the TGNC population. It is imperative that this population receive services. However, the social barriers that this population faces, such as discrimination, negative stigma, socioeconomic status, and prejudice, lead to healthcare disparities. Since many healthcare professionals do not know how to treat TGNC individuals, many have been denied care or have been refused to be treated. There is a lot of mistrust of the scientific community among the TGNC community, and this mistrust is decreasing the number of TGNC individuals willing to participate in research. Studies have looked at barriers to healthcare. However, less has been done to barriers to healthcare research. The existing research only included gender expansive people as participants and has not explicitly involved gender expansive people further in the research process, either by taking their feedback into account through a community advisory board or as peer researchers. This information will allow researchers, as well as other individuals, to gain a broader understanding of TGNC individuals through education on this community's experiences.
So from the literature, we identified the need to address barriers in research with the TGNC communities through a social justice framework. Social justice theory can be generally defined as the fair and equitable distribution of power, resources, and obligation in society to all people, regardless of race, ethnicity, age, gender, ability status, sexual orientation, and religious or spiritual background. Historically, this theory has focused on equality of social services and inclusion in life activities. We are intending for the research to inform future ethical practices with TGNC communities, and our overall goal is meaningful and equitable engagement with TGNC communities.
Once we dove into the existing research and determined the theoretical framework for our study, we began to establish our methodology. We used a qualitative phenomenological design for this study in order to explore the lived experiences of TGNC participants in healthcare research. The study was conducted using 3 semi-structured interviews, each an hour in length, and to gather information regarding the participants' previous experiences participating in healthcare research. The study design allows researchers to identify issues in particular areas of concern while maximizing the depth of participants' responses, and also allows participants to explain their experiences and past research in a manner that is not limited by designated responses. For the interview format, during our first interview, we introduced our study, shared our pronouns, and asked our initial questions. During our second interview, we conducted initial member checking and asked follow-up questions on the content from our previous interview. And during our third interview, member checking of revised themes occurred and participants had the opportunity to expand on previous conversations. Participants completed a demographic questionnaire that allowed us to gather background information on our participants and helped to provide context to the data we collected through our interviews. Our survey tool was then designed by first reviewing the literature for survey tools used in previously published qualitative studies that address similar topics to our own, and a list of potential interview questions was then compiled based on the findings from the literature review, and the most appropriate questions were selected to incorporate into our study and altered to address the topics of the interview being conducted with our participants. We also had members of our community advisory board review our interview tool to ensure the questions being asked were relevant and the language used was appropriate. They also provided us with additional questions that we had not thought of previously on neutral experiences that participants may have had with research. Topics addressed by our interview questions included participants' experiences in healthcare research, their own beliefs about research, their perception of the role of the researcher, and meta questions about our own research study.
When thinking about our methods, there were several ways in which we intended to ensure validity. We engaged in reflexive practices through online TGNC trainings, journaling, and ongoing peer discussions. Interviews were conducted in teams of 2 or 3, and then each researcher's work was peer reviewed by another on a separate team. We also did member checking with the participants at the second interview and third interview, as previously discussed. In several instances, they were allowed an opportunity to more deeply describe their experiences. We discussed our findings with community experts to see what they were using, that practices we were using were consistent with their understanding and experiences. We created an audit trail for accountability, and it was especially helpful when working with the Community Advisory Board. The Community Advisory Board was a group of 4 Tgnc members and leaders that we met with 3 times throughout the process to assist us in understanding our own biases and walk the talk of doing research with Tgnc representation. There was diverse representation in gender identity, research experiences, and perspectives. They helped us triangulate data, peer review research findings, get specific about language, and understand the intrinsic barriers to equity. Our participants were recruited by advertising on social media and LGBTQ or Tgnc specific organizations. Our main criteria for participants were 1, to obviously be transgender or non-cisgender, and to 2, have been participated in healthcare research in the past. Using critical case purposive sampling, we found the following 5 participants, as you can see. This table is a compilation of their demographic data with pseudonyms, of course. Most of the sample was white, college educated, partnered, and transmasculine. There were diversity in gender identity, geography, sexuality, and research experiences.
So now I'll talk a little bit about our data and results. So for data analysis, we recorded and transcribed the interviews through Zoom, and then we edited the transcripts and we coded the transcripts as well. And then we swapped interviews with another research team so we could check for consistency in the codes. So now I'm going to be going over the themes, and we found about 5 themes when we looked through the interviews, and we also found some sub-themes to those themes. So the themes that we will be discussing today are just disillusionment, respect, and value of Tgnc researchers. So the theme of disillusionment was kind of our overarching theme that kind of tied together all of the other themes. And this was kind of described as when participants had certain expectations, but they were met with negative experiences that caused harm. And then another sub-theme of this were both wishes and non-representative sampling. So Gabe said that they would like researchers to recognize the trans community exists and is a valuable community to be researching, but also not hyperfixating on maybe more stereotypical or narrow-minded approaches, but seeing trans people as people. We want to be recognized as everybody else, but we also, in certain aspects, don't want our trans identity to be invisible, to be avoided or ignored or dismissed. So if I were developing a study, I would do things like including areas where you can ask a person about their gender identity with a lot of options and variety.
So this theme relates to the nuances and complexities of respect, and we understood it in 3 different parts. First, the idea that basic respect, such as gender affirming language and researchers using participants' correct pronouns or names, is a good start, and these positive intentions are very important. However, these good intentions don't necessarily translate to positive impact. Researchers can still be unintentionally harmful even when being respectful to individuals in Tgnc communities participating in their studies. Finally, this leads us into the importance of intentionality having a positive impact when working with Tgnc communities. Researchers' behavior and study design must be thoughtful and purposefully beneficial to these communities. And so under our main theme of respect, we had 3 sub-themes of building trust and respect 101, respect while causing harm, and respect goes further than pronouns. And one of our participants, Adrian, explained, I think it's less about political correctness and more about just being respectful of people. I think it's simpler than a lot of people think it is. Like, as long as you just believe someone when they tell you what their gender is and use the right pronouns for them, that's going to go a long way. If you do those 2 things, that's good. And one of our other participants, Kennedy, stated, I like intentional research. I like that y'all included your pronouns in your email with your team. I've liked when surveys have been very transparently queer positive, because I feel like there's a difference between when someone sends me a survey or whatever, and it's like they're cis and they view trans people as a population to be studied as opposed to a community to learn about, you know?
All right, the final theme that we will discuss today is the value of TGNC researchers. In short, members of TGNC communities need to be involved with research and their voices need to be amplified. This would lead to better research, better results, and research that would better serve TGNC communities. We identified 3 sub-themes: categorization and labels, importance of TGNC researchers, and barriers for cis researchers in TGNC research. So for the first sub-theme of categorization and labels, Reese described the damage that labeling caused by saying, when they're asking you things about yourself, and they're trying to place you into categories for the research, and you're like, I'm just trying to do something. It's not related to my gender, but you're going to ask me. For importance of TGNC representation, many of our participants said that there needs to be TGNC representation in research. From the perspective of a participant, Kennedy said, if there's a trans person involved, awesome. If there is evidence that you have vetted your questions with trans people, that's great. If I know that at least a little bit of effort has gone into not traumatizing you with your research, I'm a lot more likely to participate, at least. This isn't a terrifying entity of all cis people. From a researcher's perspective, Vani said, I think it's really cool because we, of course, have a very intimate understanding of what we're researching and are able to get really nuanced in ways I don't believe cis people could. One barrier that cis researchers have is being blacklisted by TGNC researchers. This is no accident, however. Those researchers earn their spot on the blacklist. Can you describe this by saying we have a blacklist because these are people who have done really harmful research and refuse to examine their practices?
So this was not an exhaustive list of all of our results due to time, but through conducting the interviews, we were able to learn about the participants' lived experiences in healthcare research. We were able to explore the following questions: what are the experiences of TGNC participants in research, and what motivates TGNC people to be involved as participants in research?
So Vincent 2018 believes that ethical research in the transgender community must include the importance of transgender history, the assurance of transparency, the significance of nuanced language use, the benefits of feminist methodological contributions, the value of intersectionality, and the necessity of respecting trans spaces. The themes that we found were consistent with the comments made by Vincent. Under our theme of respect, we learned about ways that researchers can be more respectful to TGNC participants, which may include using proper pronouns and terminology throughout aspects of the research process. This relates back to Vincent's comments on nuanced language use. Our theme regarding the value of TGNC researchers overviewed how including TGNC researchers could improve ethical research conducted on TGNC communities, which relates back to the literature on the value of intersectionality within research. Finally, our theme of disillusionment, we learned about situations in which TGNC participants had negative experiences which ultimately harmed them. This is consistent with the literature on the importance of transgender history because you need to take into account possible negative history that members of TGNC communities have faced and understand that it may be more difficult for them to trust researchers who are not members of these communities. Some surprising findings that we found it surprising to learn that many of our participants wanted basic respect in the research process. We thought this was surprising because we consider basic respect to be the bare minimum when conducting a research study. We also were surprised that many of the participants wanted future research on TGNC communities to focus on positive experiences rather than negative. Many participants talked about how most research studies conducted are on negative topics, which often can be stressful for these individuals. We also found it surprising that our participants wanted heterogeneous research teams. We had hypothesized that many of the participants would want research conducted on TGNC individuals to be conducted exclusively by TGNC people. However, many just stated that they wanted TGNC representation on the research team. Finally, we found it surprising that despite instances of disillusionment, participants chose to participate in a research with altruistic hopes of giving back to TGNC communities to combat misinformation and prejudice, as well as to validate the experiences of community members.
So as with any research, there were some limitations to our study. The student researchers obviously had minimal experience in conducting research on this level. We had only interacted with the community advisory board 3 times, and our study had already been started, but it would have been better for them to be involved in the initial design and recruitment process. There were also some limitations in demographic inclusion for our participant group with a sample that may affect transferability. And this included only 1 person of color, no trans feminine individuals, and participants representing a limited education and income levels.
When working with marginalized communities, it is crucial to reflect on the biases we bring as researchers. These quotes are reflexive journaling entries from our research team members that highlight some of the main takeaways we had as a group. Just for time, I'm just going to read the first one. Quote, "My assumption going into this project was that the participants were going to have lots of negative experiences to share, and that the data would be saturated with these experiences or even lack of experiences. But that was not necessarily the case. Participants highlighted several positive experiences and even cases where this sort of research was being done already. So for recommendations for future research and researchers, using a CAB and member checking enables thoughtful and meaningful engagement with the community being impacted by the research. In order to conduct trauma-informed research, one CAB member suggested a lot of cultural humility, having the research team know about the trauma that is being experienced, and constantly having a feedback loop with community members. It is a give and take. Areas for future research should have direct benefit to TGNC communities and be directed by TGNC community members themselves, with researchers taking the role of amplifying their voices and needs instead of dictating them. And for acknowledgements, our community advisory board of Luca Maurer, Raya Reed, Andrew Roman, and Kai, and of course, our advisor and fearless leader, Joe Ungco. Thank you, and any questions?
Congratulations. Great job, everyone. If you would unshare when you get through the references, cool. And I'm going to look through the group and see if there's any questions. You can raise your hand. You can do that physically. You can do that with the reaction buttons, and I can give a call out, or you could also type a question to Jenna as the other option in the chat box. Any questions for this group?
I can get us started while we're waiting for folks to have a chance to put their questions in the chat or kind of formulate any questions they might have. So first of all, thank you. I think this is a really obviously important research topic. Well done. I really appreciated that presentation. My question is kind of a big picture one in that one of your research questions was looking at what are the experiences of the TGNC population in research, or at least your participants. And I was wondering if you all could expand on that a little bit. I heard a lot of great recommendations, but can you kind of give an overall summary? I know that's a funny question because I'm sure it's very nuanced, but kind of a summary of what you heard as far as the extent that your participants have participated in research and what those experiences looked like or sounded like.
Yeah, I could talk about this. So a few of our research participants actually were researchers themselves. So a lot of them were really motivated to be included in research to kind of make more ethical research. And so we found that they had a lot of different experiences in research. Many had really good experiences, many had a couple bad experiences, but they kind of, a lot of them stated that sometimes the bad experiences make them more motivated to want to participate in better research and to create better research. And so They all had different individualized experiences, but it was really nice to hear about them and to hear their suggestions for how to make research more ethical.
Thank you. Oh, yeah.
I think where the research was really dichotomous too was if they had had a really good experience and they described that and that really painted their participation, and if they had a very bad experience and that very much painted their experience. But they also still had this, like Shannon used the word altruistic. They still wanted to participate and still wanted to, take the brunt of maybe some being mislabeled or some gender dysphoria that could be caused, and to actually contribute positively to research.
And then, sorry, I don't want to take up too much of the airwaves, but follow-up question to that is, were the experiences that they were describing, were they a mix of as researchers or as research participants, or maybe both?
So they all had experience as a attendee in a research study, like as a participant. But I think only a couple of them talked about being a researcher. But we kind of were able to get their thoughts on both of them, which was a really nice addition to our study because we didn't originally recruit for that. But it just so happened that a couple of them happened to be researchers. So it was nice to see what they personally did in their research studies to make it more ethical.
And I see we have a question from Kim. So I'm going to mute yourself and go ahead and ask.
Hi, great job, everybody. I really enjoyed the presentation and really felt like this is important work, and your methods looked really great and your themes look really great. I think you did a really excellent job. So congratulations on that. But my question was that I was interested in how you would link this back to your knowledge about occupational therapy and occupational science.
I can start off. So I think one of the things when we were talking about this research topic that we really focused on in relation to occupational therapy was the need for evidence-based and client-centered practice, because that's obviously something that we're all taught, to really put at the forefront of our work. But we were seeing that, there's barriers to being evidence-based, right? When there's not evidence that includes all of the people you're going to be working with. So that was definitely our big thing, the significance to occupational therapy. And then also just knowing that gender expansive or Tgnc communities, people in these communities may have different perspectives on the occupations they do. They may have occupations that are unique to them. And we as occupational therapists obviously can be informed about that if we don't have research that includes their voices and perspectives.
We have a few questions in the chat here. Dara asks or says, I was curious regarding the difficulties in finding research or obtaining research during the height of the pandemic. Can you speak a little bit more to that? Your experience with finding or obtaining research during the pandemic?
Yes. So I'm assuming you guess that they're asking about, the evidence the articles that we found, or recruitment wise?
I would maybe guess recruitment wise.
Oh, okay. Yeah, so we recruited through different websites, either or we found different organizations online that we thought, could help us out. So we found either LGBT or trans specific organizations online, and we emailed them, and we typed out this email and said, hey, could you promote this? Could you see if anybody wants to participate? And we did get a couple of responses that said, yes, sure. And then within a couple of days, like 1 or 2 days, we already had 9 people sign up. Not everybody was able to be included though, because not everybody participated in healthcare research. but that was pretty surprising to us that we got that many people. And something else that, one of the participants had shared was that they will share research in, a group for trans people, and they will say, oh, these are good people to work with, or these are bad people to work with.
Thank you so much. We have a few more questions in the chat. Maybe Dr. B or Anne can direct me as far as how many we can take. But Mark asks or says, thank you for the excellent presentation. Will there be any more follow-up to this study, or with the same people that were spoken to, or others?
I can speak on this. So actually this year we got accepted to the AOTA conference, but since we were not able to finish our research on time, we were most likely going to try and do it next year. But there has been talk with our community advisory board, who were very helpful and informative to us. And there's a lot of interest with them, as well as we're going to reach out to our participants to follow up on this research.
Yeah, I guess I should piggyback onto that one as the advisor who will be doing the follow-up stuff. We also got written permission from all of our participants because they wanted follow-up. They want a recording of this presentation, for example. A lot of them are invested in that process. I think also part of, at least for me as the PI learning in this process, was to move away, well, to build off of the community advisory board. So now we actually have some of those advisors acting more as co-researchers on the next project. So looking at opportunities to continue amplifying those voices, thanks to the themes I got to learn from my own students here who did the analysis. And so working on ways to continue looking at ethical research practices and how to build them in and integrate them more thoroughly. So thank you for that question about follow-up. We're figuring it out, but it's definitely one of our key takeaways from this process.
Thank you. And one more question. I think we have time for one more, Jenna, and then we will want to move on to our next presentation.
Okay, great. This question is from Shannon. Shannon asks, can an example be provided as to specifics about a positive versus a negative experience? And it sounds like she's asking about your participants' experience they've had in research.
So I will give an example of an anecdotal story from one of our participants about explicitly a negative experience. There was an organization, we'll say in Ithaca, that they were a part of the research for, and that immediately the screening tool or whatever that they used for the research was male, female, and that was all that was offered to them. And so they actually chose to participate in the study as exclusively female, even though they outwardly show a quote unquote male experience, and they identify with being male, and they use he, him pronouns just because of the anatomy and things. And there were all kinds of dysphorating experiences, and they had there are all kinds of problems with the transferability and the data and everything like that because of this identity, and because they were not included properly in the study. And that was a very harmful experience for them, because they just didn't understand, this study didn't understand their needs.
And then I can share something about positive experiences. It varies among, which participant we're talking about, but one of the participants that I interviewed talked about a certain organization that they think more highly of. And if I do remember, we asked them, out of 10, how would you rate your trust in researchers? And they gave that institution an 8, just because they went through the right process. They made sure that they are not just asking about binary genders, leading up to it. They were very, what they called transparently queer positive. So they knew what they were talking about. They did their research on how not to cause harm to these participants. And they were just completely, respectful of pronouns and their histories.
Great, thank you so much. What a wonderful presentation, such meaningful work. Thank you so much for all your efforts, the team, Joe, and everyone else who's gotten the students this far. So congratulations, everybody. Very great. So we're going to switch gears a little bit and we're going to move on to our next presenter, and that will be Matt Darby.